So, I'm going to talk about a sensitive and uncomfortable topic. So, just be forewarned. Forewarned. It's about hypersexuality. It's an embarrassing topic, and it's like um, kind of a very uncomfortable one. But I'll read some things I saw online just from uh, ChatGPT and also my own experiences about it. So, it says, just Googling it, it says hypersexuality or compulsive sexual behavior involves persistent, intense sexual fantasies, urges, or behaviors that feel uncontrollable, consume excessive time, and cause significant distress or impairment in life. Often used to cope with negative emotions like anxiety or depression, and can stem from underlying issues like trauma, brain injury, or other mental health conditions, with treatment focusing on therapy and addressing root causes. So, I mean, that all sounds pretty accurate. I suffer from um, some form of hypersexuality or compulsive sexual behaviors, and it really is suffering because it's like the first thing I have to say is it's very embarrassing. That's like the very first thing. It's like really shameful and embarrassing. It's like that's like the number one thing. Um, like within my own family, or even around like friends, or when I used to have friends, but most people generally, the topic as soon as it gets brought up or mentioned, everybody starts to act weird. They act quiet, uncomfortable, start laughing, especially younger people start laughing like instantly. And I get it, it's kind of funny. Or it used to be really funny, but it got played out so much when I was younger, and it just kind of like, you know, it's kind of retarded. Like it gets retarded. Um, it just gets really played out. And then certain people, especially in school, always making dick jokes, always making some kind of like dirty humor jokes. And then I graduated school, and then I went to like uh, work in the aircraft industry, and it was like dick jokes. The manufacturing industry. And so it kind of doesn't change ever, really. But maybe that's not a terrible thing, but the hard thing is it's like if it's something that you suffer from and you can never actually get help from it because it's really hard to. And the other thing is I've tried to get help for this before, actually multiple times, and it's hard to get help for as well. I've tried to see specific therapists about it, and those guys didn't really know how to help. They weren't able to help really, and one of the guys was like weird. Um, he was like, he just seemed like a redditor or something, and he was like trying not to laugh or something. Like he had this weird expression on his face, and yeah, he was really patronizing as well. He like held up a book and he's like, "Well, do you believe in this?" It's like, what the heck is your problem? Like, this guy is weird. Um, yeah, I don't like when people advertise that they can help with something and then they're not really able to, and you just are left wondering, well, what do I do now? Why did this not really help? But anyways, um, I would say so. Yeah, number one, it's really embarrassing and shameful is the number one, and then number two, I would say it's definitely trauma related, um, because in my own life, like I was exposed to pornography like way too young. I think I was 5 years old, or I was 5 years old, and so that's not good for any child. And then um, number two, or another thing that happened was that my mom scared the crap out of me, uh, telling me about sex when I was like, I think I might have been 5 as well, or 5 or 6, but she took me into the basement bathroom and was trying to like explain basically sex to me, and it scared the crap out of me. Our basement was really scary. She had this like, she just freaked me out basically because I couldn't understand, you know, much of what was going on. But it was just her expression kind of freaked me out, and the way she was talking, and so that messed with me. But then I developed this like pornography and masturbation addiction for like 25 years, and then I've tried to quit at various times, and it's always been like a shameful thing. And I've tried to quit like a bunch of times, and I have like kind of succeeded at certain points, but you know, uh, like quote unquote breaking free for certain amounts of time, but sometimes months. But it is really a difficult thing, and especially it's trauma related, because I noticed that when I get stressed out, it's like masturbation is like something that calms me down, and I think that's because they say it's like a self-soothing behavior. And again, it's very embarrassing, I understand that, but I don't think there's any way to not talk about it in order to fix it. So if I were to just never say anything, it's like nothing ever happens, nothing ever changes. And so yeah, if people want to make fun of me or something, that's on them. That's their choice. But it is, honestly, it's kind of like it's an impairment. It's like some sort of like brain issue or trauma issue or something, because it's like really like distressing. You know, it's especially hard to resist. And then my brain, it's like something deep in my brain is like telling me to watch pornography and masturbate. It's like urges, you know? And I think that it's complicated because a degree of that is normal, you know? Especially as a teenager, I think a lot of teenagers, it's the hormones and everything. Everybody kind of knows about this. But for some people, it can be extremely, like, it can be too much, is the point. And I think they say that it's a problem when it becomes like, persistent, intense sexual fantasies, urges, or behaviors that feel uncontrollable, consume excessive time, and cause significant distress or impairment in life. And yeah, it's true. It's like, I don't want to be having urges like that, but it's kind of like that's what I say. Like it feels uncontrollable. And then the other thing is that I forget what else I was gonna say. Oh yeah, well, it causes significant distress. Like it like messes with your relationships too, and that's kind of like one of the worst things to have messed with, is because it's like the relationship is excessively focused on sex, and that's not really like a good thing. You know, a lot of people's relationships are that way, I think, and a lot of people are that way too. You just have to look at the statistics on pornography use, and there's many things that would indicate that that is true for a lot of people. But yeah, I think it's tough because it's like being in a state of craving or desire, and it doesn't really feel that good, like, either. But I will say that my brain like hurts a lot of the time. Like my body and my brain actually hurt a lot of the time. And one thing is that I think like it's also like a subconscious or some kind of a my brain telling me do this because it'll take the pain away for a little while. I think there's some element of that going on as well. But yeah, I just have like headaches all the time, and I also have like a song playing in my head all the time, and it's really brutal. Yeah, but I try meditation and stuff, and I continue on with that stuff, and I go to the gym and I do a lot of different things to try and help. But so now I'm going to read the symptoms. It says, the symptoms are intense, time-consuming sexual fantasies, urges, or behaviors. Unsuccessful attempts to control or reduce these behaviors. Using sex to escape from stress, depression, or loneliness. Continuing sexual behavior despite negative consequences, e.g., STIs, relationship problems, job loss. Feeling shame, guilt, or deep regret after sexual activity. So yeah, a lot of those hit home, and I don't even really want to go into the gory details of those, but I will say, or the graphic details of those, but I will say that a lot of those do apply. The unsuccessful attempts to control or reduce these behaviors, yeah, totally, that applies. Using sex to escape from stress, depression, or loneliness, yes, exactly, like that applies to my life for sure. And continuing sexual behavior despite negative consequences, yeah, kind of, yeah, definitely. Feeling shame, guilt, or deep regret after sexual activity, definitely, yeah. And I read like a little bit of a book. I found like this book, they have these little free libraries where you can go, and it's like a little box on the street. People put books in and take them out. And one time I think I saw a book that was like about sex addiction, so I took it out. I was reading a little bit of it, and it was saying, I think the title was like Lonely All the Time. And that kind of makes sense for sex addiction. Some people say that it's like a misplaced need for intimacy or love or something like that. And one thing it was just saying about like, it had stories, but this book was old. It was like from like the 80s or 90s, but it had stories and it was kind of like eerily similar, but I just understood it because it was these stories of these guys, like real life stories. One guy, he said he would just like drive around looking for hitchhikers to pick up or prostitutes or something like that. And it was like, for him, he would just go around and it was partly like the search, like just searching and, you know, fantasizing and all this. And I think in a lot of ways that's similar to dating apps as well. And I think it's weird because that guy's story was way more extreme, but the dating apps and that, it's kind of like a lesser version. But I also read in this other book about complex PTSD by Pete Walker that there's like a type of complex PTSD person who will just sit and like scroll pornography like for hours. And you know, I've definitely done that before. People joke about it nowadays. There's like a term for it, gooning. And I remember back when I was in high school, one of my friends would talk about basically that. And it was just like, I don't know, just weird. Like, it really is like kind of like an insidious impact on people's lives. But it's hard to actually talk about it. That's the main point that I'm trying to make. It's very hard to talk about it. So anyway, oh yeah, and shame, guilt, or deep regret after sexual activity. That one's really hard because, you know, I was part of the hookup culture and I've had many sexual partners, but it's like sometimes you feel like terrible after having sex with someone, and it's like you don't even really know why, and it kind of like doesn't feel good. Like, so it's really tough. Like it's really an impairment. You know, it's like an intimacy impairment, and it's very tough. I will just put it that way. So because obviously I think everybody wants to have like a healthy relationship where you know, the needs of each person are being met more or less, and it's kind of like healthy, and sex would be a part of it. It wouldn't be the entirety, and it's supposed to be, honestly, it's supposed to be like an expression of love, isn't that right? So yeah. Anyway, but okay, so I'm just going to continue on here. It says causes and links. Underlying conditions: bipolar disorder, ADHD, PTSD, personality disorders, dementia. So yeah, I wonder if some of those have something to do with dopamine dysregulation or deficiency in some way. But ADHD definitely. But yeah, I don't know. It's PTSD. You know, I have complex PTSD or PTSD and dissociative subtype, which is really tough. And yeah, trauma, it says, often a coping mechanism for past sexual abuse or neglect. Oh yeah, I forgot about that. I, you know, it's trigger warning again, but I was like sexually abused by the older neighbor kid. I think I was like 5 years old again. And I don't really remember everything, but and I don't think it was like a super bad incident. I'm not trying to minimize, because I know people get mad about minimizing stuff like that, but I don't think it was like on the order of some sexual abuses are very extreme, but it was definitely not a good incident. And then the thing is, I went home after, and I told my mom about it, and she wasn't really able to help. She didn't even really seem to care. She just kind of like just ignored it essentially. So and yeah, so it says, I'm trying to continue on, but I feel emotion coming up from the recounting or recalling the story of what happened there. But it says brain issues, injuries or tumors affecting the frontal lobe. I've had like 5 concussions. Brain injury, concussions are really bad for you. They can lead to you know, quite terrible effects like depression, anxiety. They can lead to confused thinking. I think they can increase your chance of like dementia or Alzheimer's perhaps. But brain issues or brain injuries are really, really terrible. It says medications, side effects from certain drugs like those for Parkinson's. I know that when I was taking all these different antidepressants, it messes with your sexual function, and a lot of people, this is known, and a lot of people talk about this, and they tell you this when you're going to be taking them. And I don't recommend antidepressants for people. I recommend trying other things first, because a lot of doctors will try and put you on them like that, and they're really much worse for you than you really understand. And I think a lot of people understand. You can look at Dr. Joseph Witt-During talks about this, but with antidepressants, it's yeah, they're kind of strange, and they can mess with your libido, take it away, usually, or make it stranger. But and by stranger, I mean you can look it up. It just can mess with your sexual function. But neurobiology, it says, involves dopamine pathways in the brain's reward system. Yeah, it makes kind of sense. Like if you have ADHD, one of the theories is that you are not getting enough dopamine, which causes you to seek out stimuli or stimulus in the environment, one of which would be what gives you dopamine. Well, pornography does. It raises your dopamine by about 200 to 300%, and it's very quick. And so some people, they can masturbate like many different times until they injure themselves, actually. And it's like continuing to just try and get more dopamine into your brain. But obviously that's not a good thing. And then it says treatment approaches: psychotherapy, cognitive behavioral therapy, CBT, to manage urges, address trauma like EMDR, and develop coping skills. Well, I've tried a lot of that. I do have a therapist now that I talk to about my issues, and like all the different traumatic things that have happened in my upbringing, which I've never really talked about with anybody, despite having going to therapy for many years. Like I had to like force my therapist to listen almost. It's very difficult to get them to actually talk about what matters sometimes. And one of the things I was talking about was, these sexual related adverse childhood events, you could call them. That is a term that they use. It's like ACEs, adverse childhood events, and it's connected. Actually, there's a famous study called the ACEs study, where the number of ACEs, or adverse childhood events, that a person has, it correlates to, later dysfunction in life. And I think it's like if you have over 7 ACEs, then there's like a really high chance for you to have some sort of mental health issue or other issue later in life. I've got like, I don't know how many, 20 something. I've got like a ton of them, like, and it was almost like all the time too. So it's like the deck eventually gets so stacked against you that something happens, like you end up with some psychopathology. But it's pretty difficult to work through all of that. And it says addressing root causes, treating co-occurring mental health conditions or trauma. Yeah, it's important, and something I'm trying to do. And medication, it says, can help with underlying issues like depression, anxiety, or impulse control. I've tried quite a few different medications, and honestly, I'm not a huge fan of medications. Really not very much at all. Antipsychotics, if you're on them for long term, they have side effects, and one of which is like it shrinks your brain volume. So it enlarges your ventricles. Like they showed brain scans of people who were on antipsychotics for long term. Well, the ventricles, which is like a fluid-filled space in the brain, were enlarged on the people who had been using them for a long time. Well, it's not that their ventricles enlarged, it's that their gray matter shrunk. I think their gray matter and white matter both shrunk. It could have just been one of either the two, but and I don't really want to misquote the study, but the point is that it shrinks your brain volume. That's not a good thing. And the other thing is that it can leave you with what they call tardive dyskinesia, which I already have that now. I was on an antipsychotic for maybe like a year or something like that, and this one psychiatrist put me on so much stuff, and she had me on like three different antipsychotics, but some of them were like take as needed. And at the time I was kind of like thankful, because I thought maybe this is going to help, because I was experiencing so many different problems. And that's really how people kind of get onto this stuff, is that they're looking for something to help, and then here's somebody who they think is credentialed, knows the problem, knows how to help and fix it, but the fix sometimes is like even worse, or it's just like you're anesthetized or sedated the entire time, which is actually quite close to the truth. But there's many reasons for that treatment model, but part of which being financial. Not a lot of that stuff is not in the best interest of the patient. It's just kind of to manage the quote-unquote problem. But one of them is tardive dyskinesia, which is where you will have something that's kind of like an uncontrollable behavior, something like a hand movement. Your hand will just like jut randomly, almost, or uncontrollably. I have something, it's like a swallowing thing. It's like I will swallow kind of, pronounced. I don't think many people really notice it or care, but maybe they do notice it at least. But it's just like a swallow. And I don't know if I really had that before, but it's not too bad. And apparently that stuff is permanent as well. Okay, so and then it says support groups such as Sex Addicts Anonymous, SAA, or Sex and Love Addicts Anonymous, SLAA. I would go to a support group if there was one. I've checked around, I think before, but I didn't really see one in my city. And there's that show on Netflix called Love, which I actually watched. I kind of liked it. And the girl in that show was a Sex and Love Addicts Anonymous member, and it was I kind of liked that show for some reason. It was kind of a weird rom-com or dramedy. I don't know. I guess it was a rom-com, but that's kind of my whole video for today. Just a very uncomfortable topic. Very important part of life, so felt I needed to address it. And another thing is that I think about this sometimes, how there's so much advice and so many videos on YouTube and stuff where it's like you get these really professional people, or you can just Google it and you get like the most up-to-date thing from ChatGPT, which is generally accurate, though not maybe all the time. And so a lot of people are intaking information or consuming it, but I wonder about those people, and I never really see it's kind of hard. You have to dig to get real life stories a lot of the time, and you don't really get many stories that are that seem that real, in a sense. Like, if you get the person's story, it's kind of like in an interview or something. So I just wanted to share mine, just as kind of like a real life reference, and also because it helps me too to express it. But I will say it is a very challenging, difficult thing to deal with, because it kind of like eats away at you from the inside out, is a good way to put it, because it's just like something that you always have to resist, and it's difficult. But I think that there is like a power in resisting. Some people talk about this. They call it semen retention or whatever, but maybe there's some truth to that. I haven't really studied it too well, but I know that just the self-control or self-discipline thing or willpower thing is important, and it kind of makes you stronger as well. So yeah, it's a good thing to not masturbate, not watch pornography. It's actually good for you in your life, almost like for your energy or for your life force. So yeah, in a strange way, and I can't articulate it very much better than that or give much of a scientific basis for that beyond that. But I will say that I've noticed the opinions are very mixed when you Google it. Like I used to Google it, I remember before, and I'd see different things about masturbation or sex or whatever, and sometimes the information is really mixed or pornography use, because some people actually promote it. Some people say it's like a good thing and it's like a healthy thing and it's a normal thing. I remember I was in high school. Okay, here's another story. We were having some sort of a sex education class when I was in high school. I don't remember the grade. I think it was like probably grade 10 or 11. And there was a point where you could ask questions to the teacher. And somebody asked about masturbation and whether it was really bad or not, and the teacher said it's good to get the pipes moving. It was like a female teacher. I think she was the gym teacher, and she said it's good to keep the pipes moving. It's like, dude. So we're being taught in school that's like a good thing. I mean, I don't think that should be the message from the staff. But it was, and that teacher later turned out, or maybe she was at the time, but she later married a woman. She was like a lesbian or something. I don't know, it's crazy. So, yeah. That's my whole story for today. Very embarrassing one. Yeah. It's really tough, actually. It's very, very tough. And also, much of the dating stuff is like, really lends itself toward the pursuit of sex as well. So, yeah, I don't know. It's kind of... Yeah, I don't know what to say exactly about all of it. But I'm still learning and trying to deal with my, past issues and then, like, essentially course correct. And it's really hard, honestly. It's very hard. I've been trying to do that for many years. Oh, I ordered a red light therapy light today. 800. It can do 810 nanometers, which is the wavelength, and it can also do other wavelengths as well. But I was specifically looking for 810 nanometers because I saw, again on Twitter and X. Oh, and I want to say thank you to my. Sorry, I'm kind of all over the place. I want to say thank you to my commenter from commenting on my last video. I really appreciate the comments about pen pals and sending letters. I agree that there is a special feeling when you send a letter to somebody or receive one, and I really enjoy that. Like, I don't think have I ever sent a handwritten letter. I've always wanted a pen pal, but one thing I like about that is the practicing your handwriting aspect. I think it's such a nice thing when people have nice handwriting, and everybody used to have, or most people used to have nice handwriting back in the day, but they don't even teach it in schools anymore. And or if they do, they don't do a very good job. And yeah, so my handwriting is not great, but I can handwrite. I think it's okay. I've had some compliments. But yeah, anyways, thank you for the comment. And I hope that you get to send handwritten letters to your friend. And then back to the wavelength stuff. Yeah, so I ordered that light. It was kind of expensive. It was like $270 or $80. But I was reading the studies on it, and it said that red light therapy, under certain protocols, meaning certain wavelength and certain period of time and certain joules per centimeter squared or something like that, milliwatts per centimeter squared, will or has shown in studies to reduce depression and anxiety. And there's quite a few different results. The results are very, mixed around and not concrete, but they do show there is definite results about red light therapy. So anyways, I went and bought one, and looking forward to it. And my EMF canopy did not come. It got delayed until January 8th. So I think I might message Amazon and ask for a refund for the express shipping, because I paid extra to get it sooner, and then they just went and delayed it anyway. So I could have, just gone with the regular standard shipping, but it wasn't that much money. It was like maybe $7 extra. But I did want it sooner. So oh well, that's too bad, but it's okay. And yeah, I used the sauna today. Sauna is also very good. The Huberman Lab podcast with Dr. Rhonda Patrick was pretty recently came out. I think it's the most recent one. It was like a short episode, and she was talking about different protocols, but one of them was using the sauna. And I really miss having a sauna. I used to have one in the basement of the house that I lived at. I was renting a room, and I would use that sauna pretty often, and sauna is great. I really wish I had a sauna again, but they're very expensive, and it doesn't look like the ones you can get for cheap are very good. Like it doesn't look like they get hot enough, and that's really what you want. You want your sauna to be, I think, at least 170 degrees Fahrenheit. Although I'm sure you can get some benefit from less heat, but 170 degrees Fahrenheit or above, I think, and you want to be in there for like at least 20 minutes is the sweet spot. And if you do that, I think 5 to 7 times a week, your risk of dementia decreases by 60%, but there's also many other benefits. I think increased HGH, human growth hormone, and that'd be good for exercise and building muscle. But I think you can sweat out microplastics. I think that's a very recent thing that I saw, was that there's like above 80% reduction in microplastics from using sauna. I don't remember the exact protocols, how many times or how hot or how long, but I did see that. And everybody's got microplastics in them now, and for men, they actually accumulate in the testicles. And there's this whole thing about men's testosterone is dropping, and maybe some people wonder why all these guys are like really faggy and really soy and really not masculine and very feminine. And I'm not trying to be really mean by saying that, but I am just trying to point out a fact that men's testosterone has dropped a lot. And if you know about testosterone, it deepens your voice, it causes you to grow facial hair, it makes you more aggressive, it also makes you take more risks. It has effects on people. And if your testosterone drops a lot, another thing is testosterone, if you have high testosterone, you're not as susceptible to other people's emotions, meaning like you're more blunted to them and less empathetic. I think that is I don't want to be misquoting it, but I think that's what I saw. Or you're less affected by other people's emotions, I think. And so if you have all these men whose testosterone has really tanked, I think it's dropped by like half since maybe like 100 years ago. And again, I don't have the exact facts, but I'm speaking kind of paraphrasing it loosely, although I know that it's pretty much, this is proven and shown that it has dropped. And that's why these guys are all kind of like, you know, I don't know how to put it. Less manly. But these things are factual, so that's why I point them out. You know, I feel like just because people's feelings are involved, you don't have to really. I think it's still important to point out the message, because the message, it's like a scientific and it has real world effects. So, yeah. Interestingly, if women take birth control, they're more attracted to men with less masculine faces. That's interesting, isn't it? So, yeah. But, yeah, birth control has not been good for women as well. A lot of women think it has been, but it has not been good for women. Yeah, a lot of these things are like trade-offs as well. But the red light therapy, I hope that comes in. I would like it specifically just to see if it could help with depression and anxiety. It says that it had really good effects, so I'm looking forward to it. It's supposed to be coming in next week. And then today, I went over to visit my mom. She's staying at my auntie's house. So she was homeless and now she's over there. She was staying with me for a long time and it was really tough. But now she's staying over there because my auntie has another house in another province that she goes to during the winter with my uncle, and they wanted someone to look after their house. So my mom is there, and it's good that she has a place to stay. And I went and visited because she made chili to take to the church to donate, because they were asking for chili donations. They do a thing where they give out chili every year. It's kind of an annual thing, and they ask for donations so that they can give it out to 500 people. And so it was nice of her to do that. And then I had chili there, and I went in the sauna. They have a sauna there. And I told her to go in the sauna because it can reduce the chance of Alzheimer's and dementia. And she's like 67, so it would be a good idea to do that. And I wrote the protocol down for her and left it on a sticky note so she could remember to do it. But it was nice of her to offer me a meal. And then I drove her to take that to the church, but she was asking me, I kind of had to hold my boundaries because she was saying about how there is a game night at the church tonight, and she was kind of like not really saying much other than saying that there was. And I said, okay, well, that's a good thing. And so I said, well, are you going to go to that? And she said, no, I couldn't do that. And I was like, okay. And then she asked, well, are you going to go to that? Would you go to that? And I said, well, you're just trying to get me to go so I could be a support to you so you could go. And she said, no. And I said, well, if I went, would you go? And she said, oh, yeah, I would go. And I said, exactly. You're just trying to get me to go so I'd be your support. And I said, I'm not your parent. You know, don't put me in a situation where I have to act like it. And I'm not really trying to be mean. I'm just trying to like hold a boundary. And the way I see it as well is that she does it kind of like in a manipulative fashion. Instead of saying, I'm kind of nervous to go to these things, but I'd like to go. Would you come with me? I would have probably said yes. Um, the way people phrase something, it actually has an impact on how other people respond. And I, I'm kind of over giving the benefit of the doubt and trying to flip everything so that I can be as nice as possible, because it always screws me up. Like, it never works. It's never the result that I think it'll bring. It's just like it kind of feels like being used, and I really don't like that. So if it was like a straight up request, then I would have said, okay, sure. And if it was like she said, because I don't feel comfortable going alone, I probably would have said, sure, that's fine. I can go. But it's because she like phrased it in a weird way where it's like, would you go to that? I'm like, she's trying to like piggyback off of me wanting to go. It's not even my idea. It's like, she wanted to go. She can go. You know what I mean? Yeah. And honestly, I think it would be a good idea to go for her, because it's like a community event. It's really important for people to be involved in community. When people just sit at home on their phone, it's terrible. But at the same time, I have to hold a boundary. So yeah, I think that's pretty important. Yeah, but yeah, we went on a walk after, and it was actually a nice day today. The sun was really shining, and the sky was blue, and it snowed in the morning, and it was like very beautiful white. And there's like fluffy snow everywhere. So. Hey, cat. So anyways, that's my entire video.